China's epidemic turns grim. Sudden collapses among young and old raise alarms. Last week, the Chinese Communist Party, CCP, unusually announced the number of COVID-19 deaths in May, revealing the severity of the outbreak. Many residents across China revealed that hospitals are overcrowded with no available beds, severe white lung syndrome affects people of all ages, and the number of sudden deaths among young and middle-aged people has risen sharply. The actual death toll is believed to be much higher than the official figures. Some crematoriums have also reported long queues for cremation. On June 5th, the Chinese Center for Disease Control and Prevention, China CDC, reported 440,662 new COVID-19 cases nationwide in May, including 606 severe cases and 7 deaths. However, many people across the country have stated that the Chinese authorities routinely hide data, and the actual number of deaths is much higher. Mr. Wang, a hospital employee in Hefei, Anhui Province, revealed that the outbreak has recently resurged, and one of his acquaintances is currently hospitalized in serious condition. There has been a sharp increase in lung tumors, which can develop into pneumonia or lung cancer, resulting in many deaths. However, this information is being censored, and hospital staff are prohibited from disclosing it. Mr. Wang, hospital worker in Hefei, Anhui. Around me, there are several white lung cases, including young people, students, and also elderly people in their 60s and 70s. The hospital has no vacant beds. There have been several sudden deaths, people in their 20s and 30s. Some died on the streets, others had meningitis. We're not allowed to talk about it publicly. Mr. Wang also revealed that local crematoriums have been handed over to private operators, and cremation is mandatory with very high fees. People who cannot afford it are forced to secretly bury their dead in rural areas, but this is strictly controlled by authorities, and violators face heavy fines. Mr. Wang. There are many deaths at the crematorium now, and people have to wait in line. Cemetery plots are always expensive. Some cost 70,000 to 80,000 yuan, or even over 100,000. You have to cremate before burying, or else you'll be fined if caught. It's just an extra step and a complete waste. Mr. Hao, a resident of Anyang City, Henan Province, said that many people now have weaker immunity than before, frequently experiencing colds and full-body fatigue. These are believed to be long COVID symptoms. Sudden deaths among young and middle-aged people have significantly increased. Mr. Hao, resident of Anyang, Henan. It just keeps going. Hospitals are always full. This year, sudden deaths have increased, even among the young. People in their 30s to 50s. I know 3 people, all young and previously healthy. They were said to have died of heart disease, but in fact, they had no history of heart problems. Mr. Ma, a resident of Zhejiang, said the pandemic never really went away. 2 middle-aged acquaintances of his died suddenly. One died while on a train for work, and the other while driving on the highway. Mr. Ma, resident of Zhejiang. The situation is quite severe. Sore throats and hospitals are always crowded. Now the media also call it COVID, but ordinary doctors don't dare to say that, as it could get them in trouble. Many young people are dying suddenly. 2 people around me, one over 40, the other over 30, died suddenly. Mr. Li, a resident of Shijiazhuang, Hebei Province, revealed that currently many school children are infected and have to stay home for treatment. Mr. Li, resident of Shijiazhuang, Hebei. Many kids are infected, with high fevers and severe symptoms. It's usually sore throat, still viral, hard to treat, and nothing really works. COVID outbreak, resurges in China. Doctors expose CCP's cover-up after the Chinese Communist Party, CCP, made a rare admission that COVID-19 is resurging. It quickly claimed that the epidemic situation has eased. However, many residents across different regions in China told New Tang Dynasty Television, NTD, reporters that the virus never disappeared. A new wave is currently sweeping the country. Hospitals and clinics are overwhelmed. Sudden deaths are frequent. Even doctors have died at their workplaces. Some medical professionals have come forward to expose the CCP's long-standing tactics of concealing the COVID-19 outbreak. In early May, the CCP unusually acknowledged a rise in COVID-19 cases. However, by May 28, state media quoted the CCP's Bureau of Disease Control as saying the nationwide upward trend in COVID-19 was now slowing down. By late May, a Chinese doctor told NTD reporters that the pandemic never left. Authorities banned any mention of the word COVID and refused to officially acknowledge any outbreak, handling everything according to political needs. Dr. Kang Hong from a clinic in Guangzhou said, "The authorities monitor everything, but they never speak plainly. Just like with PCR testing before, there was a time when they prohibited it. If you wanted to get tested, it cost over 100 yuan. Doctors would just say, whether it's COVID or not, it's still a viral infection, a respiratory infection, so let's not bother." Now, they've resumed testing because the state needs surveillance to be prepared in case something big happens. Dr. Kang Hong also revealed that the outbreak has returned recently, with many people becoming infected. At a frontline hospital in Guangzhou, an elderly doctor contracted COVID-19 and died while on duty. Kang Hong, "COVID has a higher fatality rate than the flu, with more severe symptoms. I normally don't wear a mask, but now I have to. It mainly affects the elderly who are more susceptible to pneumonia. Some recover, but some don't. At the frontline hospital where my daughter works, an elderly doctor passed away. He was still working, but within 2 days, he couldn't hold on. Tests showed he had severe symptoms. That kind of case is classified as a work-related accident." Recently, in cities like Shanghai, Guangzhou, Yunnan, Hunan, and Guizhou, several well-known doctors have died suddenly. The oldest was 64 years old, the youngest just 37. Kang Hong further revealed that even if someone dies from a COVID infection, hospitals are not allowed to report it. Kang Hong, "At my clinic, more than half of the patients have flu-like symptoms. We don't test anymore, and the patients don't want to be tested either. Everyone already knows it's COVID and doesn't want to waste money on testing. For a long time, hospitals didn't test because it would cause panic. After all, whenever someone dies, people get scared. Right now, the health authorities have told us that we don't need to report anything. Regular hospitals also do not tally deaths caused by COVID. Official statistics come from designated monitoring stations, hospitals selected for surveillance. Testing costs at these stations are covered by the government, allowing authorities to monitor the situation." Kang Hong, "For example, in Guangzhou, there are dozens of monitoring hospitals, usually frontline hospitals with fever clinics. These fever clinics existed even before COVID. Now, anyone who comes in gets tested right away. The cost is covered by the state, patients don't have to pay, which makes it easier for the government to control things, while ordinary people remain unaware." Dr. Chen Yang, a traditional Chinese medicine doctor in Zhuzhou, Hunan, also revealed that the authorities are always hiding the epidemic. Chen Yang, "The virus is surging again. I believe it never really stopped. I regularly receive patients. After failing to recover through Western medicine, they come to me. Taking traditional Chinese medicine works better. Some people died, but no one is allowed to say it was due to the virus. I estimate that in China, about 1 billion people still haven't been infected, and the virus has already killed at least several hundred million." Mr. Liu, a resident of Yulin City in Shaanxi province, said the outbreaks keep recurring, and many people around him suffer repeated fevers and colds. Mr. Liu, "Many adults are getting sick, fever, diarrhea, sore throat. Quite a few need IV drips, though most can recover. It usually takes at least a week. Many residents in Shenzhen have also revealed that there are currently many COVID cases and that hospitals and clinics are overwhelmed." Mr. Jian, a resident of Shenzhen, "Southern China is hit pretty hard. In Shenzhen, lots of hospitals and clinics have long lines. Everyone has sore throats and fevers. According to the official definition, this is COVID, a variant of it. But if someone dies from it, the government will never say it was because of COVID." Mr. Tao, a resident of Jilin City, also reported that many people around him have died, but such information is strictly blocked by the authorities. Mr. Tao, "Lately, there have been quite a few deaths. Several people passed away just in the past few days, including both elderly and younger folks. One elderly person was still alert, went for a walk in the morning, and died before they could even make it to the hospital. There have been quite a few deaths."
China's economy is in serious decline, and the banking industry, once known as the Iron Rice Bowl, is facing a dilemma of salary cuts and layoffs. Recently, many banks released financial reports revealing that 4 banks laid off more than 4,000 people in the first half of the year. As of August 20th, financial reports released by several listed banks, including Nanjing Bank, Ping An Bank, Pudong Development Bank, and Shanghai Rural Commercial Bank, showed that many banks not only saw a decline in revenue, but also implemented salary cuts and layoffs. According to statistics from Oriental Fortune Choice, 4 banks, Nanjing Bank, Ping An Bank, Pudong Development Bank, and Shanghai Rural Commercial Bank, laid off as many as 4,116 people in the first half of the year. American economist David Huang stated, "In the past decade, China's banks have been overdeveloped because more than a decade ago, China sought to emulate the financialization of the United States to dominate the world. Now, this unchecked growth has hit reality, forcing a contraction when it proves unsustainable. This is the first reason." Among the 4 banks, Ping An Bank laid off the most employees. The bank's latest total number of employees is 40,130, down from 43,119 at the end of last year, with 2,289 people losing their jobs, representing a layoff rate of 5.6%. David Huang added, "The second reason is that the management model of Chinese banks is more bureaucratic, leading to inefficiencies in profitability, risk management, and overall system management. Now that the economy is down, these existing issues are becoming increasingly prominent. These leaders are unwilling to resign or reduce their salaries, so they are forced to start with staff layoffs." Pudong Development Bank laid off 1,663 employees in the first half of the year, reducing its workforce from 60,706 at the beginning of the year to 59,043 by mid-year, with an overall layoff rate of about 2.7%. In the past year, the bank's employee expenses fell from RMB 13.729 billion to RMB 13.640 billion. 7 months ago, China Construction Bank, one of China's 4 major state-owned joint stock commercial banks, also reported salary cuts. Mainland media quoted relevant people from CCB as saying that the bank is comprehensively promoting salary adjustments, which not only cover the functional departments of the head office, but also extend to the subsidiaries under the group. The average salary of head office staff has dropped by slightly more than 10%. The financial industry was once referred to as the Golden Rice Bowl or Iron Rice Bowl. With the recession of China's economy, more banks have gone bankrupt or been merged and reorganized. David Huang commented, "Bank layoffs and salary cuts, along with the dissolution of small and medium-sized banks, indicate that China's entire financial system has grown too wildly over the past decade, especially in the development of financial services, including banks and securities companies. The next downfall could be in the securities companies." The latest data released by the State Administration of Financial Supervision of the Communist Party of China shows that at least 50 small and medium-sized banks in China have been dissolved since the beginning of this year, most of which are rural small and medium-sized banks. David Huang stated, "This has a huge impact on the lives of ordinary people, as the bankruptcy of these banks often means that the savings of depositors over the past few decades could be lost. Foreign investors are even more worried because China's financial systemic risks are crucial to the overall investment environment." According to incomplete statistics from the State Administration of Financial Supervision of the Communist Party of China, as of July 25th this year, nearly 1,500 bank branches have closed down.